Marley Drug.
Hi, my name is Monica and I'm a pharmacist who works with Marley Drug Pharmacy. Let's talk about Imiquimod, a treatment that can really help if you're dealing with certain skin conditions like actinic keratoses, superficial basal cell carcinoma, or even external genital and perianal warts. So Imiquimod is a topical cream, which means you'll be applying it directly to your skin. It works differently than some other treatments because it doesn't just go after the problem directly. Instead, it helps your immune system do the heavy lifting. When you apply it, Imiquimod triggers your body's immune response, getting your immune cells to release special chemicals called cytokines that help fight off abnormal cells or viruses. You might hear Imiquimod referred to by brand names like Aldara or Zyclara, and depending on which one you're using, the strength will either be 3.75% or 5%. It is part of a drug class called topical immune response modifiers, which basically means it's all about boosting your body's natural defenses. Now, the way it works is interesting. When you apply Imiquimod to the affected area, it activates your immune system to fight off things like abnormal cells. This can be especially helpful in treating conditions like actinic keratoses or certain viral infections like genital warts caused by HPV. It's even used for some cases of skin cancer like superficial basal cell carcinoma. So while it might take a bit of time for you to notice changes, it's actively working to clear the issue by helping your body target those abnormal cells. When it comes to applying Imiquimod, it's important to follow your healthcare provider's instructions. For conditions like genital warts, you might use the cream anywhere from 3 times a week for up to 16 weeks, depending on the brand and strength. If you're treating actinic keratoses or basal cell carcinoma, the application schedule can vary. For actinic keratoses, you might be applying it either daily or twice a week for several weeks. And for basal cell carcinoma, the cream is typically used 5 times a week for 6 weeks. Before using it, make sure the area is clean and dry. You'll apply a thin layer just before bedtime, gently rubbing it into the skin. Let it sit on the skin for about 8 hours, then wash it off in the morning with soap and water. It's very important to wash your hands well after applying the cream so you don't spread it to other parts of your body. Avoid getting it into your eyes, mouth, or nose, and if it does get into your eyes, rinse it out right away. One thing to note is that it's pretty common to have some skin reactions. Redness, itching, or even a burning sensation can happen. You might also see some swelling, scabbing, or peeling in the area where you're applying the cream. Don't worry if your skin looks worse before it starts to get better. That's usually a sign that the immune system is doing its job. However, if the reaction seems too severe, like intense blistering, ulceration, or significant swelling, it's really important to contact your doctor immediately. You may also experience some flu-like symptoms like a mild fever, headache, or muscle aches. These can happen because your immune system is being activated. Again, if anything feels severe, it's always better to be cautious and get in touch with your doctor. Before starting this medication, it is a good idea to have a conversation with your doctor about any skin sensitivities or other medical conditions you have, especially if you're pregnant or breastfeeding. And don't forget to mention any other medications, including over-the-counter products or herbal supplements, just to make sure there are no interactions. Finally, if you're not seeing improvement or if your condition gets worse, let your doctor know. They might need to adjust your treatment plan, and it is important to stay on top of any changes to your skin. Following up with your doctor is key to making sure the treatment is working the way it should. So while this medication can require some patience and can cause some skin reactions, it is working to give your immune system a boost in clearing up these abnormal cells. You can read more about Imiquimod on our website, so check those articles out in the links below. And if you have any questions, be sure to ask your doctor or leave them in the comments below. And don't forget to subscribe. Bye for now.